prevention emergency here in New York City, and most people don't seem to realize it. Today we're at Mount Sinai because the state has guidelines on post-exposure prophylaxis for people who may have been exposed to HIV during sex. ACT UP has documented 6 incidents in the last few years where people who were in an emergency situation of needing post-exposure prophylaxis or PEP went to emergency rooms or clinics, and they were either told no such treatment existed, or they were given great delays, or turned away entirely because they didn't have something as trivial as current ID.
Any occupational exposure automatically triggers free 30-day PEP at any medical provider. Yet in New York State and New York City, there are only selected few hospitals that have funding to provide PEP for sexual or for exposure through needle sharing.
When a major hospital like Mount Sinai denies someone PEP when they come in after they've had an unsafe sex incident, that is essentially saying, we don't care. If you worked here, you'd get PEP right away, but you're just another gay man. We don't care.
Speaking as someone living with HIV, and as a new ACT UP member, I personally feel it's very important to fight to make PEP available to everyone who presents at an emergency room, at a clinic, even at a pediatric emergency room, because as an HIV positive person, we want to make sure we can do everything we can to protect our partners. If a condom breaks, we want to make sure that we can send our partners to somewhere and they're going to get effective treatment immediately that will greatly reduce their chance of becoming HIV positive.
If you've had a risky experience, and if you were trying or not trying to use safer sex practices, you are still entitled as a human being to seek exposure treatment.
We know that shockingly few people in our community, a full 8 years after these guidelines were first put out, know that there is even such a thing as post-exposure prophylaxis.
There's a desperate need for education here in the city and, quite frankly, our nation about what post and pre-exposure prophylaxis is. Everybody knows what the morning after pill is, but nobody knows what to do if you've been either exposed to HIV through sexual contact or through accidental contact with a needle. And there's a huge knowledge gap in our country of what those things are.
There are new prevention methods to help combat the HIV virus. And particularly now, in the time where HIV rates are growing among black and brown youth, it is very critical that we get the education and information out there that there's a such thing as PEP and PrEP to help combat the rising rates of HIV in my community.
Too many years into the epidemic, we want it to be over. So we're using every tool in the toolbox.